One should have four very important pieces of equipment. The first one is a visual acuity chart, and preferably a distance visual acuity chart or Snellen chart. Right. The second one is an eye occluder with a pinhole device working to this. And the third one is a very bright light, an electric torch. And the fourth one is an indirect ophthalmoscope.
Right, well, let's just take us through this one first of all, Patrick. That's basically a very simple item of equipment, which, can you just run through how it's used?
Yes, this is actually a board type. It has a notch in the middle which sits squarely on the nose, and that would orientate the patients which eye that needs to be occluded and which eye they need to test vision out of.
So you check acuity first of all with this.
First of all, up with the open hole in the middle. Right. We first check the visual acuity with the right eye, then turn it around and check the visual acuity with the left eye. Now, if perchance the visual acuity is very poor, then we do not know whether the patient just needs a pair of glass or contact lens or needs his glasses to be improved, or something inherently wrong with the eye with an organic disease. Right. And one can obviate that dilemma by using pinholes. Right. Now, pinholes serve the purpose of a best pair of glasses the patient can ever get. All right. Now, this occluder has a mechanism with a pinhole with a little board that can flip up and down, a whole series of holders, so that the patient can pick one and peek through that.
Right. And that immediately corrects for any
correct the refractive errors. So if the patients have very poor vision with an open hole, then we can use a pinhole to see if the vision could be improved with a pinhole. Right. If the vision could be improved with a pinhole, then the patient just have a refractive error, and that the patient does not have an organic disease that disturbs the vision.
Now, if we just move to the ophthalmoscope, obviously a good instrument is important. What are the features of a good ophthalmoscope?
My opinion of ophthalmoscope is that ophthalmoscope has to be heavy. Right. It's just like a tightrope walker walking on a tightrope. It needs a heavy pole to steady the hands. Right. A heavy ophthalmoscope can steady shaky hands. Right. Okay. The second thing the ophthalmoscope needs to have is a very strong light, so that we can see what we need to see. Right. Okay, especially through cataract, especially in old people. The third one is I would like an ophthalmoscope to have a very small aperture through an undilated pupil, because when the light aperture is very large, then most of the light will be reflected back at the observer, and that would be more disturbing to the observer than illuminating the retina with it.
I mean, are the student ophthalmoscopes satisfactory, do you think, for student use?
For general purposes, yes.
Yes, right. And it's important to get used to your ophthalmoscope and to get used to fitting it how it fits into the corner of your eye.
Yes, absolutely. And I would suggest to begin with, one should start closing off one eye and just use the observing eye and put this in front of the pupil and just use one eye and try to get a view out of the middle of the ophthalmoscope.
With the ophthalmoscope really as close
as closely as possible, and hopefully resting on the eyebrow. And most ophthalmoscope has a little pad on top and to rest on the eyebrow.
And if you've got glasses, as you have, you would use your glasses, would you?
Yes, generally I would prefer to leave my glasses or my contact lenses on. And I think that would obviate the chance of dialing in all these lenses in the ophthalmoscope.
Right. Well, let's move to our first case.
Good.